I'm about to show you why waking up with a bright red blood spot in your eye has absolutely nothing to do with rubbing it too hard in your sleep, and everything to do with a catastrophic pressure surge happening inside your arteries. Why that gray-white ring developing around the color part of your eye is not just a harmless sign of getting older, but a screaming biological alarm that your blood vessels are turning into rigid, calcified lead pipes. I'm about to expose the vascular physics that make your face the ultimate diagnostic mirror for your cardiovascular system. Why the tiny, broken purple veins showing up on your cheeks are actually physical blowouts caused by chronic, unrelenting hydrostatic pressure. Why your doctor taking a quick glance at your face and telling you to just use moisturizing eye drops or cosmetic creams is leaving you totally defenseless against a looming stroke. Stay with me. You look in the mirror every morning. You notice these subtle changes. You see the red spot in the white of your eye. You see the milky ring around your iris. And you assume it is just the inevitable wear and tear of aging. But your body does not randomly break its own blood vessels or deposit cholesterol into your eyes for no reason. These are systemic warning shots. You're about to learn how to read your own dashboard and exactly what nutrients you must swallow to physically reinforce your fragile capillaries before the next pipe bursts. Comment below if you have ever woken up with a sudden red spot in your eye, or if you've noticed a white ring forming around your iris. Type mirror if you want the exact biological protocol to read these signs and stop the damage. You're about to learn why treating the surface of your eye is a waste of time and how to fix the high-pressure engine underneath. I'm Dr. Noah Grant, and last month I had a patient named Thomas who survived a massive stroke solely because we paid attention to a tiny red spot in his eye. Thomas was 68 years old. He came into my clinic completely unbothered, just asking for a routine refill on his blood pressure medication. But when I looked at him, the entire left half of the white of his eye was stained deep, bright red. It is a condition called a subconjunctival hemorrhage. I asked him what happened. Thomas laughed it off. He said he must have sneezed too hard yesterday, or maybe he slept on it funny. His primary care doctor had seen it 2 days prior and told him to just use some artificial tears and it would fade in a week. I didn't give him artificial tears. I immediately checked his blood pressure. It was 175/105. I asked Thomas when he takes his blood pressure pill. He said he takes it every morning at 9 a.m. I realized instantly what was happening. Thomas was experiencing violent, uncontrolled morning blood pressure surges while he slept, and the fragile blood vessels in his eye were physically blowing out from the pressure. I shifted his medication to nighttime and started him on a targeted capillary strengthening protocol. 3 weeks later, his pressure stabilized, the eye cleared, and we prevented the exact same blowout from happening inside his brain. Let me show you the terrifying biology of what these facial symptoms actually mean and the 3 vascular alarms you must never ignore. The first alarm is the one Thomas had, the red blowout. To understand why this happens, you have to realize that the human eye is the only place in the entire body where a doctor can physically look at a naked blood vessel without making a surgical incision. The whites of your eyes, the sclera, are covered by a thin, clear membrane called the conjunctiva. Running through this membrane are thousands of microscopic, incredibly fragile capillaries. They're only one single cell thick. When your cardiovascular system is healthy, these capillaries effortlessly handle the flow of blood. But when you have uncontrolled high blood pressure, especially overnight or during the early morning hours, the physics change dramatically. Between 4 a.m. and 8 a.m., your body naturally pumps out cortisol and adrenaline to wake you up. This causes a natural spike in blood pressure. But if your arteries are stiff or if your blood pressure medication has worn off from the day before, this natural spike becomes a violent hydrostatic tsunami. The pressure inside your entire vascular tree explodes. The heavy, thick arteries near your heart can usually withstand this force. But the microscopic, one-cell-thick capillaries in your eyes cannot. The sheer mechanical force of the blood pushes against the fragile capillary wall until it stretches beyond its elastic limit. The pipe snaps. The blood violently leaks out and pools trapped between the clear membrane and the white of your eye. Because the membrane is transparent, you look in the mirror and see a terrifying pool of bright red blood. When your doctor tells you that you just sneezed too hard, they're completely ignoring the systemic physics. Yes, a sneeze temporarily raises pressure, but a healthy capillary does not explode from a sneeze. It explodes because it has been systematically weakened by chronic hypertension, and the morning surge finally pushed it over the edge. If a microscopic blood vessel just blew out in your eye, you must immediately assume that the microscopic blood vessels deep inside your brain are under the exact same catastrophic stress. The red spot in your eye is a warning shot. If that exact same blowout happens in your cerebral cortex, it is a hemorrhagic stroke. The second facial alarm is a silent, progressive change that happens right over the colored part of your eye. It is called corneal arcus or arcus senilis. If you look closely in the mirror at your iris, you might notice a milky, gray, or white ring forming around the outer edge, separating the colored part of your eye from the white part. Most people assume this is just a cataract or a normal sign of getting older. It is neither. That white ring is a massive, physical deposition of oxidized cholesterol and phospholipids. Here is the biology of how it gets there, and why it means your blood pressure is destroying your arteries. The cornea of your eye has no direct blood supply. It is completely clear. In order to get nutrients, it relies on diffusion from the blood vessels at the very edge of the eye. When you have chronic high blood pressure paired with high levels of oxidized, toxic LDL cholesterol, your blood is effectively turned into a pressurized, inflammatory sludge. The sheer physical pressure of your hypertension forcibly pushes these sticky lipid molecules out of the bloodstream and directly into the peripheral tissue of your cornea. The cholesterol literally gets stuck in the tissue, creating that highly visible white ring. Why does this matter for your blood pressure? Because if your body is forcing cholesterol into the clear tissue of your eye, it is absolutely 100% forcing that exact same cholesterol into the smooth muscle walls of your arteries. Corneal arcus is a visible, undeniable biological fingerprint of systemic arterial stiffness. Your arteries are becoming calcified, rigid, and clogged. They cannot expand when your heart beats. Because the pipes are turning into lead, your heart has to pump exponentially harder just to force the blood through them. Your blood pressure climbs higher and higher, forcing even more cholesterol into your eye. You cannot fix this with eye drops. You have to clean out the arterial pipes. The third alarm is visible on your cheeks and around your nose. These are the tiny, broken, spider-like purple and red veins known clinically as telangiectasia. Many seniors visit dermatologists and pay hundreds of dollars for laser treatments to zap these broken veins away, assuming it is just sun damage or a mild skin condition like rosacea. But once again, we have to look at the physics of plumbing. Your face is densely packed with capillary beds. These vessels have a tiny amount of elastic tissue that allows them to expand and contract. But when your resting blood pressure stays at 150/90 all day, every day, the relentless, constant hydrostatic pressure is constantly pushing outward against those tiny vessel walls. It is like blowing up a cheap balloon and leaving it inflated for a week. When you let the air out, the balloon doesn't snap back into a tight circle. It stays stretched out, baggy, and ruined. The elastic tissue has been permanently destroyed. This is exactly what happens to the capillaries on your face. The chronic high blood pressure stretches the vessels beyond their point of return. The smooth muscle fails. The vessel permanently dilates, pooling with deoxygenated, purplish blood, becoming visible right through your skin. Zapping them with a cosmetic laser just destroys the visible vessel. It does nothing to stop the high-pressure flood that is going to stretch out and destroy 3 more vessels right next to it next month. You must stop treating your face as a cosmetic issue and start treating it as the ultimate cardiovascular dashboard. Here is your exact, aggressive biological protocol to reinforce your fragile blood vessels, clear the rigid cholesterol out of your arteries, and stop the high-pressure blowouts. First, you must physically reinforce the 1-cell-thick walls of your capillaries to stop them from blowing out during pressure surges. To do this, you need a highly specific bioflavonoid called rutin. Rutin is a plant compound found heavily in capers, black olives, and asparagus. In clinical vascular biology, Rutin is renowned for its ability to decrease capillary fragility. It works by physically cross-linking with the collagen fibers inside the walls of your microscopic blood vessels. It acts like microscopic rebar, binding the cells tightly together and dramatically increasing their tensile strength. Thank you for watching.